Flexibility is the ability to move your joint through its full range of motion. This is very crucial during everyday activities, movements, and/or sports. However, tissue damage may occur if a movement of the joint goes past its range of motion. In this video, we will be measuring flexibility using the following tests: the Canadian trunk forward flexion test, also known as the sit and reach test, the YMCA test, the chair sit and reach test, and the straight leg raise test. You want to make sure the participant performs a warm-up before any of these tests to prevent injury and assess the true flexibility of the joint. The sit and reach test places the participant's feet against the flexometer at the 26 centimeter mark. The participant should be seated and should not have shoes on. Ensure that the participant does not lead with one hand or bends his or her knees as they reach forward with both hands as far as possible. Make sure the participant breathes normally and exhales before beginning the test. While the participant performs the test, the head should be tucked in between the arms, and the hold for the reach should be for 2 seconds. The score is the highest number in centimeters or inches recorded within 2 trials. The straight leg raise test. Participant should begin by laying in a supine or back flat on the floor position. The lower back should be compressed against the floor. Raise one leg, however, to ensure that the opposite leg is extended and remains flat on the floor. Using a goniometer, measure the angle of flexion by placing it on the greater trochanter. An inclinometer should also be placed right below the tibial tubercle. The scoring for this test is a minimum of 80 degrees is considered acceptable, 90 degrees is considered desirable. The recordings or classifications are recorded as acceptable or unacceptable. The older population has a much more difficult time performing the sit and reach test, so in consideration of these individuals and their limitations, Jones and colleagues constructed a modified sit and reach test that only tests one leg. This test is called the chair sit and reach, to test flexibility in older individuals, 60 years and older, men and women. The equipment used for this test is a folding chair that has a height of 17 inches and an 18-inch ruler. The procedures for this test is to have the back of the chair on the wall to allow for extra stability, and have your participant sit on the most anterior part of the chair. Have your client extend one leg being tested with their heel on the floor and the toes pointing straight up or superior to the heel. Have the other leg flexed with foot flat on the floor. Perform the test by having the client slowly reach for the toes with both hands, one on top of the other, keeping the back straight and the head not tucked. Have them hold this position for 2 seconds, performing 2 practice and 2 test trials. The scoring for this test is: the middle of the big toes is 0 score, any reaches short of the toes is a negative score, and any reaches past the toes is a plus score. Record best score to the nearest half inch and compare with chair sit and reach norms.